hair loss during adolescence can mean a person may be sick or just not eating right. Some medicines or medical treatments like chemotherapy also cause hair loss. People can even lose their hair if they wear a hairstyle like tight braids that pulls on the hair for a long time. Losing hair can be stressful and will definitely have a huge impact on self-esteem. So in today's video, we'll talk about what causes hair loss in young women. And if you are new to my channel and find this video valuable, please give this video a like. And without further ado, let's start with our countdown. First on our list is genetics. Androgenetic alopecia is a genetic form of hair loss referred to as male pattern baldness or female pattern baldness. It occurs in a predictable pattern. Women usually notice a gradual thinning along the part of their hair. In men, it generally appears as a recession of the hairline in an M, a V, or a U shape, and a gradual balding at the crown. Pattern hair loss usually starts in adulthood, but can also start during your teenage years. It's not uncommon for teenagers to experience this form of hair loss, but its prevalence is currently not known. You're most likely to develop pattern hair loss if you have close relatives who also developed it. But don't worry, because even though genetic hair loss cannot be reversed, there are steps you can take to slow it down and maximize your hair growth potential if detected early. Second on the list is alopecia areata. Alopecia areata is an autoimmune condition that causes hair to fall out in patches. Autoimmune conditions develop when your body mistakes healthy cells in your body for foreign invaders. In the case of alopecia areata, your immune system attacks your hair follicles. You may notice hair loss on your scalp, eyebrows, eyelashes, or body. Alopecia areata affects about 2% of the population at some point in their life. Most people develop it before the age of 30, and it can start as early as childhood. Right now, there is no treatment for alopecia areata, although there are some forms of treatment that can be suggested by doctors to help the hair regrow more quickly. The most common form of alopecia areata treatment is the use of corticosteroids, powerful anti-inflammatory drugs that can suppress the immune system. Third on the list is malnutrition. Malnutrition is a lack of proper nutrition that can be caused by not eating enough, eating too much, or not getting the right balance of nutrients. A lack of access to food, dietary imbalances, eating disorders, or digestive conditions is some potential causes. Deficiencies in nutrients may cause hair loss, including in vitamin A, vitamin E, zinc, vitamin C, iron, niacin, vitamin D, vitamin E, biotin, folic acid, and selenium. So how can you regrow your hair due to malnutrition? Diet-related hair loss can be recovered as long as the patient resumes a proper diet, keeps themselves stress-free, and maintains a healthy scalp environment. However, it may take some time depending on your age, genetic makeup, and other factors. Fourth on the list is thyroid conditions. Thyroid conditions that lead to underproduction or overproduction of thyroid hormones may cause hair loss or brittle hair. Hair loss caused by a thyroid condition usually appears as a uniform thinning across your scalp. Hair loss is most common in people with severe or prolonged thyroid disease. Lost hair often regrows with proper treatment, though it will take several months and may be incomplete. Fifth on the list is lupus. Lupus is an autoimmune condition caused by your immune system targeting your tissues and organs. Lupus can cause symptoms like joint pain, fatigue, a butterfly-shaped rash, and hair loss. Lupus causes widespread inflammation that usually involves your skin, particularly on your face and scalp. Lupus can cause the hair on your scalp to gradually thin out, although a few people lose clumps of hair. Loss of eyebrows, eyelashes, beard, and body hair also is possible. Sixth on the list is polycystic ovary syndrome. Polycystic ovary syndrome is a common female health issue that leads to excess levels of androgen or male sex hormones. It's normal for women to produce hormones like testosterone. But when they produce too much, it can lead to symptoms like disrupted menstrual cycles, acne, and hair thinning. However, hair loss is actually not a common side effect of PCOS, as compared to excess hair growth, because in order to have this type of hair loss, your androgen levels have to be pretty high. Treating the hormonal imbalances in your body may lead to hair regrowth. Seventh on our list is medications and treatments. A number of medications and medical treatments can lead to hair loss. Some examples include acne medication, antibiotics, anti-clotting drugs, immunosuppressants, gout medication, chemotherapy, cholesterol-lowering drugs, anticonvulsants, blood pressure medication, antifungal treatments, antidepressants, and mood stabilizers. Eighth on our list is hair treatment, coloring, and styling. Regularly coloring your hair or getting chemical hair treatments can damage your hair and potentially lead to an increase in hair breakage. These treatments don't usually affect your hair root, and your hair will likely grow back once you stop treatment. Chlorine found in swimming pools, bleaching your hair, and exposing your hair to excessive heat is also all potential causes of hair damage. Some hairstyles that you tend to wear repeatedly, like tight buns, ponytails, cornrows, dreadlocks, tight braids, or hair extensions, or weaves, put stress on the hair. That causes hair loss, often along your hairline, which is called traction alopecia. If you intervene early, traction alopecia may be reversible. And these are some of the causes of hair loss in young women. However, there are also causes that are not so common. Some of which are trichotillomania, which is a psychological disorder where a person feels the overwhelming need to pull out their own hair. Symptoms typically onset between the ages of 10 to 13. Next is ringworm of the scalp. Ringworm is a fungal infection that can cause patches of itchy and scaly skin on your scalp. In some cases, ringworm can cause inflammation that leads to scarring and hair loss. And last but not least is telogen effluvium, which is a temporary form of hair loss that causes excessive shedding of hair. Stress, illness, childbirth, or weight loss are some of the many potential causes. Telogen effluvium usually resolves completely without any treatment over several months. The normal duration of telogen is approximately 100 days or 3 to 6 months, after which period the hair starts growing again. And that's all on our list today, guys. And please make a note, if you see any of these on your kids, please see a doctor immediately, because sometimes hair loss can be a symptom of another disease. If you find value in this video, please give it a like and subscribe to help me grow my humble channel. You can also show your support by purchasing on my links, where I get a small amount of commission with no extra cost to you. If you need a food supplement for your hair loss, click on the link somewhere in the description to check the item. And remember, let's all become better well-being by being well. Thank you.